Monday Health Minutes, sponsored by Valley Health.
Hi, I'm Melanie Shafer. Welcome to Monday Health Minutes with Valley Health. Pap smears are a crucial aspect of women's health. They can play a significant role in the early detection of cervical cancer and other normalities. So we are talking with Obstetrician and Gynecologist Dr. Ellie Hood about Pap smears today and why they're so important for all of us. Thanks for being here.
Absolutely. Thank you.
You're welcome. Tell me what a Pap smear is, how does it work, and what does it tell you?
So a Pap smear is simply a sample of cells from your cervix. Sometimes an HPV test is done with this. The pathologist looks at the sample of cells under the microscope, tells us about any changes. We get a Pap smear by doing a pelvic exam, of course. So a lot of times at your annual exam visit, you will have a Pap smear carried out with or without an HPV test.
Okay. At what age should women or girls start thinking that they need a Pap smear?
21 is when we start doing Pap smears. It used to be a lot younger than this, and there is still people think that you have to have one younger than this, but 21 is when we start. Around age 30 is when we start adding in the HPV test as a screening. What
can a woman expect during an appointment that she would get a Pap smear in?
Right, so normally we do this at the patient's annual exam or their yearly wellness visit. Hopefully there's been a discussion beforehand about the Pap smears occurring and what to expect. We talk about a lot of preventative things at this appointment. Generally a breast exam is done and then a pelvic exam where we get the sample for the Pap smear.
Talk about HPV and what that means as far as detection of disease and how Pap smear can help in that.
Right, so HPV is a virus and it's responsible for most cases of cervical cancer. And so with that HPV test, we are detecting if a patient has contracted one of these high-risk types of HPV that will increase their risk of getting cervical cancer. So it's very important to be aware of HPV and aware of any abnormal cell changes in the cervix.
Explain a little bit more about what HPV is.
So HPV is human papillomavirus, and it is a virus that can cause cervical cancer. It can also cause genital warts and things of that nature. There is a vaccine to prevent HPV-associated infections, and we really want to prevent HPV so that we don't get cervical cancer.
Are there misconceptions that you've heard about Pap smears?
So Pap smears, having to be done when you start your period, that's simply not true. We don't start those until 21. If your mom or your sister, doesn't have a family history, you don't have a family history of cervical cancer, then you don't need a Pap. Once again, not true. Cervical cancer is not based on your family history.
What would you tell somebody who's nervous about getting that first Pap smear?
Well, hopefully they've come to meet their doctor beforehand and you've got a good relationship, you're comfortable with that provider. I like to show my patients the speculum and explain the procedure, and that generally puts their mind at ease. I tell them probably don't schedule the appointment when you have your period because you're going to be a little bit more uncomfortable. I mean, doctors don't care. We don't mind at all if you have your period or not, but I think for patient comfort, it'd be better if they didn't have their period. Some people will listen to something relaxing on their AirPods during the exam. So
that's a good tip because you do need to relax, that's for sure. So that's a good idea. If you have your Pap smear, you get the results back. What happens next if you have an abnormal result?
So an abnormal result can be anything from where we're going to recommend a repeat Pap in a year or we're going to do further testing. The further testing is called a colposcopy. And again, we use the speculum, we do a pelvic exam, we look at your cervix, and then we use a microscope to get an even better look at your cervix and take biopsies. And then the biopsies dictate what we do, after that. If we're gonna just follow this and do a repeat Pap smear, or if you're gonna need further treatment, like a LEEP procedure or a cone biopsy to remove those abnormal cells.
What final message would you like to share with women and young girls and 20-somethings about Pap smears?
Well, a Pap is really an ideal screening test. It is very powerful in preventing cervical cancer. We want to catch cervical cancer at an early stage so that it's easier to treat, better chance of a cure. It is not a reason to get uncomfortable or to be dreading it since we can do all of this great prevention with this one test. It's also important that you come in every year, and that way we can talk to you about, breast health, contraception, and other preventative care things that we can help you out with at that appointment.
Yeah, so many conversations that need to be had, and you can make it easier. Dr. Hood, thank you so much for your insight.
Thank you.
We appreciate it. Thanks for being here for Monday Health Minutes.